That said, I'm Valeria Cristiani. I'm a community pediatrician from Rochester, Minnesota. And this is my colleague, Crystal Young, from Community Dental Care. And I'm going to have Crystal say a few words.
Good afternoon. So I think maybe a few of you might have been in this room where we had Ann Copeland and Lou Gang speak about how we work with community health workers, but Community Dental Care is a nonprofit dental clinic. We have 4 clinics, 3 in the Twin Cities, St. Paul, Maplewood, and Robbinsdale, and a clinic in Rochester. We're also planning on building a second clinic in Rochester just because the needs there are just so high that we're planning on opening a new facility next fall with 18 dental operatories.
Mm-hmm. So here we're going to concentrate today, we're going to talk about community collaborations, and in particular we are going to focus on oral health education. So in this next half an hour we're going to try to focus on how to improve children's oral health through a multidisciplinary approach with a community collaborative, and then discuss how we're developing an oral health education campaign for the community. And please interrupt me. I know that we're a smaller group, so if you have any questions when I'm talking, just please raise your hand and we'll just do this more as a conversation rather than a formal presentation. So I have to tell you a little bit of the story of this task force that has a very long name. It's the Olmsted County, because that's where Rochester is, so Olmsted County Children's Oral Health Task Force. So from many, many years, in maybe more than, I've been living in Rochester since 2004, so definitely more than 12 years. As a pediatrician, I've seen that children's oral health is a huge need in our community. And I've been asked many times, okay, so what can we do about this? And I have to say that Dr. Dana, sitting like right here in front of the room, he always, remember his words from the very beginning, a long time ago, saying, Valeria, what are you going to do about the caries on all those children that you're seeing? And so that kind of like got into my mind, and now I'm well known at Mayo Clinic as the teeth lady. So that said, we know that we cannot deal with this problem in a silo, as Dr. Rose was talking. And so the Olmsted County Children's Oral Health Task Force got together to try to address the children's oral health needs in our community, and trying to do it as a collaborative rather than only from the dentist, only from the doctors, only from Head Start, only from the schools. We just kind of like came together as a community to try to figure out how to solve this problem in a multidisciplinary way. So we developed a vision, which is that all the children in our community, which is Olmsted County in our case, will have healthy mouths for healthy lives. And our mission is to promote collaboration amongst all of us, okay? So basically interdisciplinary collaboration, which is kind of like the theme that we've been hearing today with the importance of community health workers and integrating oral health in the medical home, which it should be the health home, right? So as I said, the task force was formed to try to address a very pressing need in our community, which is children's, especially underserved children that don't have access to dental care. And so what can we do about this? And we came at this together, a public health nurse, a dentist, and a pediatrician, which is myself, decided to start building this collaborative, and we called it a task force at the time. And that was we started getting together in March of 2014, so it's been really a pleasure to get to know these different stakeholders and sit at the table together, talk about children's oral health and what can we do about it. So there's broad representation from different stakeholders in the community. As I said, there's the community dental hygienist, that is the school person basically. She goes to all the schools in Rochester and does the cleanings and does the sealant program. She's part of a task force. We have pediatric dentists, we have safety net providers, general dentists, Head Start, public health nurses, and medical providers, both pediatrics and family medicine, because we should not forget our family medicine colleagues, because they see many more kids than pediatricians do. So I'm going to skip some of these slides because I think that you already all know these, that early childhood cavities is the most chronic condition, just delete the S, of childhood in the United States. And I think that I'm preaching to the choir that we know that children that have dental disease, they cannot, they are in pain, they miss school, they cannot learn, they cannot eat, they cannot develop, parents miss days of work, et cetera, et cetera, et cetera. So, and we know also that in Minnesota the situation is really not good. We know that at least 50% of or half of third graders have some dental disease, either treated or untreated, and we know that there are huge health disparities related to children's dental health. We know that minority and low-income students have at least 2 times the incidence of oral health disease. And so I'm going to tell you briefly a story about, and this is a true story. So there's a 18-month-old boy, actually, that he attends the early Head Start program. If you're familiar with early Head Start, serves children from birth to 3. And so the coordinator for early Head Start was very worried because this particular toddler wouldn't eat, wouldn't grow, and it was very fussy, crying every night, waking up in the middle of the night. The mother was so stressed. And, well, you're probably guessing what was happening. Basically, this 18-month-old had severe dental decay that, thanks to the partnerships of Early Head Start and the dentist in the area, that child got care, and then because of that, that child immediately, that was the first night that child slept through the night. It started eating, started growing, it started talking, and all that, and that happens every day. So it's not like a one case story, but those stories, we see them in practice pretty much every day. And so this illustrates not only the need to take care of the mouth, but also to create and nurture partnerships, because that child got care thanks to the relationships that were present between the Head Start program and the dentist in the community. Then I'm going to tell you that maybe you know of Olmsted County, Rochester. What do you think if I say Rochester in terms of medicine? What do you think? You think good? Did I hear best or something? Or you hear good? You think what? Far away. Yeah, it's far away from here. You're right. Exactly.
Well, just out of curiosity, why does Olmsted County have the least access? How about the western counties in Minnesota?
Olmsted County is the worst, but actually there's other counties that are really bad. When you look at how the access of children to oral health services, when you look at the CMS reports, actually they are all pretty bad. They kind of like between 30 and 45%. That's the access. So we are kind of like at the bottom, but the best are not good neither. Yeah, that's true. But anyways, in our area we have a big problem in terms of access to dentists and dental care for kids, especially Medicaid kids. And so this slide kind of like shows, and again, these reports are all public, so sometimes they're a little bit hard to find, but they're in the DHS website, and they're the CMS 146 reports, excuse me. And you can see that basically 2-year-olds, which are the kind of like the bottom hairline from 2012 to 2015, only between 3% and 7% of 2-year-olds received any dental care. That is so bad. And then when you look at even the 3 to 5-year-olds, which is the next line in red, and then the 6 to 9-year-olds is the line in blue, you can see that, yeah, they're doing a little bit better, but not that much better. So this is a picture of what's going on. And then when we compare what's going on in Minnesota, Minnesota is doing okay, but not that much better as a whole. So this is for 0 to 5-year-olds, and you see in blue is Minnesota, and in red is Olmsted County. And again, you can see that the percentage of kids receiving care 0 to 5 years, dental services through Medicaid, it's really not stellar. And I have to say, though, that when you look at the data on years before 2012, for some reason, I don't know exactly why that year looks actually higher than the years before. So I don't know if it was a reporting glitch or if it's true that for some reason 2012 got better. But the previous years look pretty much the same as 2013 or 2014. Yes, Dr. Peterson. Here.
According to our group research, by the time of 2014, they have doubled the enrollment, the enrollees, but the access did not increase.
Exactly right. Exactly right. Yes, do you want to comment?
All the kids have coverage now with the ACA.
Yeah.
All the kids have coverage, so there's going to be more kids, like you were saying, but still not enough access.
Mm-hmm. Exactly. Yes. I'm coming.
Do you think that it's not really access, but just that push to like one of the things that's real important when you look at it in the community health worker part is like, let me sit down and make that appointment for you. Let me figure out your transportation. How you getting around? Do you have bus money? Do you have cab money? Your insurance will pay for your cab for there and back to your home for free just because you're part of that insurance. You'd be surprised how many people do not know that piece. So do you sit down with the patient and say, hey, how can I get you to this appointment? What do you need? Are you hungry? What is it that are barriers? You'd be surprised how those numbers will skyrocket, to a positive, just to sit down with someone and actually tell them and ask them, how are you getting around? Can I help you?
Exactly.
Yeah.
Yes, Danita, you bring an excellent point because and Dr. Dana wants to say something.
I'm very curious to know whether, to the extent to which now, because in the past it's been zero, to what extent now is the Mayo Clinic and the Mayo Health System putting fluoride varnish on kids' teeth? Because the Mayo Clinic, is God's gift to healthcare intergalactically, and it's a shame, from my perspective, that something as simple as fluoride varnish, the Mayo Clinic has not adopted it. And Mayo Health System staffs a lot of clinics along the 507 area code from Wisconsin to South Dakota. I'm curious to know what's new. I doubt probably nothing.
No. Actually, we have very good news for you. Yeah, I do. So I'm gonna respond to the 2 points. So to Danita's point, I think you're totally right. This is this is a village's work. So we need to have more access, but we also need to have community health workers, navigators, people that help the families reach the access, right? That's another piece. The other piece is we don't have enough dentists, right? We have very few pediatric dentists. We have general dentists that don't feel comfortable seeing younger kids. So that's why there's definitely the need, but how as a community we kind of like come at it at different points. So that's what we need to do. And so Dr. Dana asked, what is Mayo Clinic doing about these? And at least since 2014, we've advanced in two ways. One is now oral health risk assessment, fluoride varnish applications are part of the preventive services for kids for the whole enterprise. So I'm talking Mayo Clinic, not only in Rochester, but also in Arizona and Florida, Mayo Clinic Health System. And we are moving now towards we started implementation. And so we started that in the Rochester area. There's in Mankato, in La Crosse, in Eau Claire. So it's slow, we're moving slow, but we're actually doing pilots to figure out how clinics can integrate that into the practice and spread it. So. In community pediatrics, we started in May of 2014. Yeah, but we started that only with the pediatric residents, and now we are expanding to all, not only the pediatric residents. So there's still a lot of work to be done, but all right. So let's see. So this is some information on Head Start. I think that just for interest of time, I'm gonna skip it, but basically what the message of this slide is, Head Start kids are 95% Medicaid insured, and they have huge oral health needs, and if we don't create partnerships, these kids that need treatment don't get it. So we do have to create partnerships. And you all know that Minnesota is doing really bad in terms of reimbursement to dentists, and so that has been the other piece that the task force wanted to concentrate on. So this is what basically the task force did. We kind of like sat together and we decided, okay, so what do we want to focus on? How do we want to organize ourselves? And so we had like 4 working groups or subcommittees, and one was oral health education, the other one was policy, and then for access, we actually have 2 different committees or subcommittees. One is in medical and dental integration, and the other one is on how to communicate, or how to interact and collaborate between general dentists and pediatric dentists. So I do have, so basically these are the goals, and I'm just gonna be talking about these ones here. So the goal to identify opportunities for pediatric dentists to work with general dentists, that what we've been doing is trying to share educational resources from the pediatric dentist to the general dentist so that they feel more comfortable seeing the young ones. And we've done that through emails, through with links to videos of training. We've also presented at the Sombro Valley Dental Society, which is the society of the dentists in our area. And we have great pediatric dentist champions in our task force, and those are kind of like the liaison to the general dentist. As a result of that, we've had at least 2 general dentists, and so, you know, these are kind of like baby steps, but at least we've had like 2 general dentists contact our pediatric dentists to get them trained and start seeing children by age 1, which is huge. We also developed, and I don't know if maybe, Crystal, you want to talk a little about the creation of that referral form, but I think that was another good result of our work together.
And so with Children's Dental Health Services, they're sealant-based, school-based sealant program, excuse me. And so what we've done is created a referral form so that we're providing more preventive services in the schools, which frees up more appointment slots for restorative appointments in the clinic. And that partnership has helped. They refer their children and the students that they see in the school to our clinic, and also then parents start learning about their services that we have available. And then also we did participate, and we had a dental capacity survey for all the dentists in the area to see how the best ways that we could partner, and also looked into see how did they serve our population? How are they serving the Olmsted County community? And we're looking now, we just did a survey this past year to see if the work that we've done since 2014 has made a difference. Also, in addition with policy changes, with the increase of the fee for rural Minnesota, has that made any differences in how dentists and dental providers are serving our community?
All right. I think we've talked a lot today, I think, about community health workers and the integration of dental into the medical home. So I'm going to be brief, and I just answering Dr. Daynard's questions, I just told you that we are working towards this. The other point is the last bullet talks about women and infants and children's programs. That's also a huge or a very, very nice setting to try to increase oral health education, and the children go there with their mothers or fathers, to get all the nutrition information. So it's kind of like another very natural setting to include, oral health education clinics and fluoride varnishes. And in terms of policy, we are very active in this area, and we held one legislative briefing session for our Olmsted County legislators back in December of 2014, and we're about to doing the same in December of 2016, which is next month, to basically always present this very clear message of, this is what's happening to children's oral health in Olmsted County, this is why you should care, and this is what you can do about it. So very succinct messaging to try to at least influence our legislators, our local legislators, so that they can continue the work at the state capitol. We also are asking the Olmsted County Board to include children's oral health as a legislative priority, and that will help use the resources of the Olmsted County government to try to put children's oral health at the top. So I think that's an ask that we just did. So we'll see if we get it. And with that, I think I'm just going to have Crystal start talking about the education piece, which is the other arm of our task force.
And so our oral health promotion community campaign, our task force goal is to develop and implement a community children's oral health promotion education campaign for children, parents, and providers. And so far, I think we're very grateful to National Children's Oral Health Foundation. They provided community education kits that the public health nurses used during child and teen checkup clinics, and also while they were visiting homes, families in the home. And Winona State University nurses will be utilizing the community education kits while they provide oral health information to children in Head Start and in the school district. So we're very grateful for their assistance in being able to educate children and families in homes and in Head Start. So the purpose, again, I think it's a continual message that we've heard all day long and that we hear throughout the years, is that we want to increase and raise awareness about the dental access issues that our populations and the patients that we serve are facing, and also the prevalence of pediatric dental disease in Olmsted County. And also, we want to enlist the help of our community to address children's oral health in a multidisciplinary way. We want to get our community members involved, the parents and the people that we serve, the families themselves, to be empowered to help improve the health outcomes of their own children and for themselves as well. The subcommittee, so how did the development of these key messages that I'll be sharing, how were they developed? And how were the audiences identified? We realized that we can't tackle the whole world at once. We've got to pare it down, start with baby steps, And a quote that I've heard is that change happens at the speed of trust. I'll say that again. Change happens at the speed of trust. Throughout the whole day today, I keep getting the feeling of building relationships. It's about the relationships you build that make an impact. How do people retain knowledge? You know, how do you convince someone to take charge of their health? What is, behavioral change? So we have identified there are 4 key audiences that we identified that we'll start out with, and we also created some key messages. Together, as a collaborative, the subcommittee members created some messages. We brought it to the task force for feedback, and we have finalized some key messages for our audiences. So for medical providers, and then these are probably going to be, things that you've already heard, but that we need to continue to promote in the community. That oral health, I'm sorry, I looked at the wrong slide. Key messages for general public. Oral health is important to a child's overall health and development. Babies should visit a dentist when the first tooth erupts or at age 1. Everyone should brush their teeth twice a day and floss. Choose healthy foods to maintain oral health. We want to start out simple first. We plan to expand this, but we want to start out somewhere where it's simple messages people can retain. A couple messages that are not up here, but that we've heard today is that the dental home is in your home, the parent's home. 365 days, you should be brushing your child's teeth. Parents should be brushing their child's teeth. As soon as the first tooth erupts, babies should see a dentist. We want to, bust myths. The myths that baby teeth aren't important, that babies they're too young to be seen by the dentist. Once we get them through the doors, that's when we can start education. That's when we can start engaging them. Key messages for medical providers. Fluoride varnish application can and should be done during well-child checks and child and teen checkups and other medical clinics. Well-child checks should include an oral health screening with appropriate referral. Again, messages we all in this room know, but we continue to push forward and promote it within other medical providers' offices, within the community, things that we know second nature, that are in the constant, in your dreams when you sleep at night, but things that we want to share and continue to promote. Key messages for pediatric and general dentists, that children's first checkup should be when the first tooth erupts or at age 1. We hear often that even in Olmsted County that general dentists are telling parents, oh, they're too young, come back and bring them when they're 3. No. If you're uncomfortable with seeing them at that young age, please provide a referral. We're trying to provide resources to general dentists to let them know that lab-to-lab exams are quick and easy, that there are resources and training modules that they could refer to. And again, if they're unable to or uncomfortable with seeing a child that young, to please provide a referral. And we have to start continuing to provide these messages to these audiences. Key messages for policymakers. Children's oral health is in a state of crisis in Olmsted County, and reimbursement for MA dental care must be increased to assure access for the most vulnerable children. In addition, Rules 2 and 3 for child care licensing should be changed to include daily toothbrushing, because currently it does not. And also, oral health screening should be a requirement of the preschool screening program administered by the Minnesota Department of Education, and qualifications for screening personnel need to be reconsidered. So for our policy subcommittee, together we've decided that these are messages that we'll be bringing to our legislators, and at our legislative briefing, we plan to include these messages. Okay, I'm doing good on time. Okay. What are the next steps? So we have all these great ideas. We have all these meetings. Who's going to take on the work? So we need to execute a communication plan. I am working with the Olmsted Public County Health's communication staff member, and with her background and skills, we're planning a communication plan. And as you'll see, the general public, medical providers, dentists, and policymakers, these are the different outlets and strategies that we'll be using. And it's all integrated because the medical providers, dentists, and policymakers, they're included in the general public. This is all integrated in our community. It's a community, children's community oral health campaign. So we plan to connect with the local newspaper, TV, and radio, continue presentations at community events through the different task force members, distribution of bumper stickers or window clings with our key messages, signs visible in public places where parents frequent, like WIC or libraries and grocery stores, the Refugee Health Quarterly or diverse media, and of course, social media. In other places, for medical providers, a prescription pad for physicians to prescribe to their patients, bring your child to see a dentist, through the American Academy of Pediatrics journal and publications, through the Mayo Clinic newsletters, for dentists, through, again, everyone has the first local newspaper, TV, and radio, but with dentists as well through Northwest Dentistry, the Minnesota Dental Association, Zumbo Valley Dental Society, through MDH's Oral Health Program website and newsletter, and through the Minnesota Oral Health Coalition, which brought us here today, and policymakers through our annual legislative meeting. These messages, I believe, and with the task force, with our multiple disciplinary team, with people who are all invested in children, it just brings a collective a message that we all together are invested, and these are the things that we'd like to see and encourage, families and all stakeholders to be invested in children's oral health. Oh, yes. Oh, sorry, Dr. Diner. Okay.
I'm curious, how often do you, when the doctor has a prescription pad, bring your child to see a dentist, does the mother say, I've tried 5 dentists and none will see me because I'm on Medicaid, I've given up? And the second thing is, you've got the Academy of Pediatrics there, but I think it's very important to remember that family medicine sees way more children than pediatricians do. You've got to include them.
Thank you, Dr. Deinard. And this is our plan, so it's actually not been, this year is when we're going to roll it out in 2017. So those are good notes that I will take down, and we have not yet. So that would be something positive or something important to take a look at, is when we do roll out the use of these prescription pads to kind of encourage parents to, bring their child to dentists to see how that works. Oh.
Say that again, Dr.
As part of my Minnesota Oral Health Project, I've developed 20 different single-page handouts across all topics, and they're available for anybody who wants them.
Yeah, I use them. I use those, yeah. So, yeah, and Yes, and definitely including family physicians, that's for sure. And then we hear as doctors, we hear a lot that parents have difficulties accessing the dentist, and so what we do is, and again, depending on where you work, you could be lucky to have community health workers that help you, but in other practices you don't. And so many times is a care team member. It could be the medical assistant, the nurse, the secretary, it could be the doctor herself. But basically we do phone calls. That's what we do. We kind of like have the patient like right there, and we're calling, okay, and we are just scheduling the appointment. And so those are the things that we have to do. Just like Lou was saying before, don't refer and just say go there. It's just help the patient and the family get there.
And so our goal is key messages. So our goal for the campaign that we'll see roll out next year is our key messages are promoted with all audiences to increase awareness and improve the health of children in our community. And it starts with us. So along with the coalition's theme, that starts with all of us invested together, and all the different professionals and people that are on this task force who really want to help children and families and parents, get access and prevent the disease. So now we'll take some questions, and also welcome to other resources or important messages that you think we could utilize. Again, we will be rolling it out this following year, so it's not too late to help us with some of these messages. Thank you.
Couple more questions. How often, as you're talking to mothers or caregivers about flossing, does the mother say, what's the purpose of flossing? These teeth are so widely spaced, the toothbrush gets between them. And second question is, have you begun to use sites such as Early Head Start and ECFE rather, and public health nursing to do a lot of educating of mothers?
So we do, the other co-chair, Marty, she is the head of the public health nurses in Olmsted County. So she uses her team and her staff. They do education of mothers and ECFEs and at WIC and at the schools. And your question on the flossing, Dr. Peterson maybe could help me out.
But before I go on to the flossing, I just would like to commend Dr. Cristiani Valeria. I have seen her work, and it takes a person, a leadership like that, who actually is an excellent example. She does what she is saying today. She put us together, and if you notice, she has recruited 2 general practitioners to do a lab-to-lab. That is commendable, okay? And it is so difficult for the general practitioner to get that idea that you start to see kids as soon as teeth erupt. Many of them still say at 3 years old, and we are trying to say, no, that's wrong, because by the time 3 years old, the child may have growth caries. And so going back to Dr. Amos' question on flossing, usually when the really young children, when teeth are spacey, you don't need to floss yet. But when the teeth start to touch, that's when you start to floss. Okay.
All right. So do you guys ever think about going into the church-based like community? It takes nothing to just call up the pastor and say, hey, can we talk to your congregation about dental care in the children? You'd be surprised or different events like that around the city, those pushes are very important when it comes to getting the word out about dental care.
Can I also speak a little bit? Oh, yeah. In the Twin City here, where I work, I do personally do a presentation to ECFE, churches, even daycare center. Yes, and yes, I've been doing for the last 10 years. And yes, but mom would say, oh yes, my child, oh, they cry so much, I can't do anything about brushing, I can't do anything about flossing. And I told them, said, the reason you do brushing and flossing, because this is what the outcome will be. So they do appreciate it, but they had to know, they had to be educated.
We'll recruit the two of you to come. We'll recruit the two of you to come. That's great. Well, very good. Any other questions? Yes.
I didn't see your PowerPoint on the. I didn't see your PowerPoint on the handouts on here.
Make sure that
Yeah, okay. We just started a coalition in our community, and I saw lots of stuff that I would love to be able to do.
Which is your community? Where is your
Southern Minnesota and Fairmont.
Fairmont? Great.
Yes, we just started a early childhood dental network, and I'd love to be able to do some of the stuff that you're doing, and I couldn't take notes fast enough. So if you could share your PowerPoint and put that on the website, that'd be great.
Perfect.
Okay.
Very good.
Thank you.
Thank you for doing that. And it's Patty. Very good. Patty Matthews. Go, Patty.
And I just want to say too, with piggyback with Dr. Peterson said, with Dr. Christiani, Marty Alaman, and Dr. Alan Carr. They're the chairs for our task force. And again, it's about building those relationships. They all came out and did outreach with us. And identified who are the key stakeholders. They came and talked to us and said that they're invested. We know that you'd be invested, and you're building a coalition of people who have the heart for it, the compassion, and they are the ones who will, follow out and do the actual work. Because again, you have these meetings, you have these great ideas, but we need the people to actually do the work. So we all do it together, yes. So it just takes, time and energy. And so I think, thank you, Dr. Christiani.